All right, so you're going to be using this worksheet in order to measure your partner for the accurate size wheelchair that they need. So it's going to ask your patient's height and weight. You are not necessarily going to need to do anything with this today, but it's something that you would need to consider because certain wheelchairs have certain weight restrictions or height restrictions. So what you're going to be doing is you're not going to measure the patient actually sitting in a wheelchair. You want to have them sitting on a mat table with their feet supported. So the high mat tables aren't going to work because they need to be lowered. Anytime you get a measurement, there's going to be times where I ask you to take the shoes on and off just to get some different measurements. But in order to get the final fit, you want them wearing a pair of shoes that they're going to be wearing like a normal pair of shoes for them, so it's like a sneaker that they would typically wear or something like that. The measurements you're going to be looking at are seat depth, which is going to be the distance from the back of their knees to the back of their buttock. When you measure this, can I have someone come sit on this for me? So whenever you're measuring this, you want to come to the side. You'll feel for the back of the knee, and you're going to measure from the side. The next one is seat width. Turn around. When you measure seat width, it's going to be the distance between the hips. You want to be behind them, and you're measuring from one side of the hips to the other. But you do not want to wrap the tape measure around their tissue. So you're just going to hold it away from them and go from the widest point to the widest point, but you need to be behind them to get the most accurate measure. So seat depth, seat width. You're going to do the seat to floor height. Go ahead and turn back around. So again, with their feet on the ground to the up behind their knees, so you're going to be beside them when you do that. And then you're going to do the seat back height, which you want to be behind them again, measuring from the back. So the key is making sure you're on the right side of the patient, that you're going to the widest part, so getting an accurate measurement. You don't want to have it a little bit less because then you're likely to get a seat that's too small. And then also not wrapping the tape measure around any of their tissues, kind of holding it away so that it stays as straight as possible. And so depending on the measurement, you're going to either add or subtract. It's important to understand why you're adding or subtracting. So for example, for the seat depth, you're going to subtract 2 inches. And that's because if you had a seat depth that came all the way to their popliteal fossa, which is the back of the knee, it's going to put pressure on the back of the knee. So you subtract 2 inches so that their leg is supported, their thigh is supported, but that they have room behind their knee that it's not getting pinched by the seat. So think about why you're adding or subtracting. Is it to support or is it to relieve pressure? When you do these measurements, you want to have your patient assume a nice upright posture because you don't want them sitting all slouched over or sitting on their sacrum in the wheelchair. Okay? So you're going to get a table that goes up and down, or that at least is low enough for the table or the person to have their feet on the floor. Grab a tape measure, which you can find over there. Hand sanitize, glove up, and wear your face shield for this because you are going to be working pretty close. And you should come up with the size of wheelchair that your patient needs. Okay?